Hi, my name's Daniel Marsden. I'm a practice development nurse for people with learning disabilities at East Kent Hospitals Trust. Over the past 8 years, we've made some really huge steps forward in relation to how we support, recognise, support and care for people with learning disabilities.
In 2012, East Kent Hospitals University Foundation NHS Trust published My Healthcare Passport to aid communication and choice making between hospital staff, people with learning disabilities and their carers and supporters. The research project that followed in 2015 sought to evaluate the use of the passport and provide solutions to help increase awareness of the passport for patients and staff and improve elements for its usability.
I used to be deputy principal of a school and college for people with special needs, and I have a daughter with severe disabilities who takes up quite a bit of my time.
My name's Tina Walker and I live in Folkestone. I have a daughter of 21 months, her name's Amelia.
I'm Rachel Giles, I'm a ward sister on Cambridge M2 at the William Harvey Hospital. Been on the ward for 15 years. I've also got a son with learning disabilities, so I have a personal and a professional interest in caring for people with learning disabilities.
I thought it would be interesting to get involved in it because the idea was that having this hospital passport that goes with the person has a lot of information, which I thought would be really helpful.
What we proposed to the Foundation of Nursing Studies is that we would do a participatory action research project into the implementation and evaluation of My Healthcare Passport.
The passport is a very important piece that patients use to be able to communicate to healthcare staff what we need to know about them that they may not be able to communicate to us. It's something that I felt wasn't promoted enough in the hospital. People didn't seem to really know about it, the staff. So I felt if we did a bit of research and looked at promoting it and how we can improve it, that would help.
I was very confused because you didn't go into too much detail, so I committed myself to it because I knew it was around the passport, so I wanted that all to change, so because there was lots in it that we needed to improve in it.
I have a daughter with severe disabilities, as I say, and she had a lot of difficulties in hospitals over her years. She's nearly 34. And it's always been difficult when she goes into hospital. And I had a very bad experience with her quite recently, just before the research started. And Daniel had got involved because I'd complained about what had happened, the experience for her. And because of that, and then getting to know Daniel, he then asked me, would I be interested in becoming a co-researcher on the project?
What was really interesting about in exploring this idea about action research, and particularly participatory action research, is the mutuality of it. So it's done over a period of time, and it's an exploration, it's a joint exploration together with people. And that sounded very much up my alley because it was inclusive and it held true to my values and beliefs. Over the period of a year, we went on this journey together, and we learned a lot about ourselves and a lot about the role of being a co-researcher, the challenges of non-NHS people being part of NHS research.
It was great meeting people from all different walks of life. We all had something different to bring. Some people I found particularly inspirational in what they'd achieved. Sounds X-Factor-ish, but it was a journey. And I think from talking to other people, we felt a little, we don't quite know where we're going. There wasn't like map and directions. We all had decided at the beginning what we wanted as our dreams for the end of it, but I don't think we were all quite sure how we were going to get there.
I enjoyed meeting the group because it was a mixture of everybody, and we got on really well. And it was amazing how we all came with different expertise. I have a lot of interest about how to and passion about how to change things for the better for people with learning disabilities, and how people's lifestyles are, and I had a lot of input into the passport and how people use it.
One thing that a lot of the patients find is, particularly if they've got communication problems, they're not being asked questions over and over again, that people can just look in the passport rather than struggling to identify from the person or their carer or their parent what their needs are. And it just enables you to get a picture of that person, much like the This Is Me that's used for patients with dementia.
What was interesting is that before I was asked to go on this, I knew nothing about them. And as I say, Amy's now 34 and she'd been in and out of hospital all her life, and no one had ever mentioned one to me before about has she got one or have you heard of it? No one had ever mentioned it in any of the hospitals. So it was completely new. So this is one of the things that was of interest to me, to try and get it out there and get people to know. Because I've always been, because of Amy, I've always been an advocate for people with disabilities. So all her medication will be kept up to date on there. And also it has things on there about her behaviours. This is where it's useful. I can make sure that all that information is in that passport.
We identified some of the things that we thought we were good at, some of the things that, the special places that we had, special skills that we possessed. We then presented those to each other. We did a hopes, fears and expectations exercise. So you start off at one end thinking about the dreams and aspirations of the group. What do we want to get out of this, based on the fact that we've come together to think about implementing and evaluating My Healthcare Passport. Then we took a step back and started to think about, well, okay, we've got a year, so what are the goals? What are the achievable goals within that time? So we had the meetings, we had the 10 meetings, and within those meetings we used various activities to identify how we were going to get to the dreams and aspirations, the outcomes that we had on our big poster. Some of it was about identifying and going and consulting with stakeholders. We identified that there would be two main ways of doing that. One would be through a survey. We also recognised that it would be really useful to go off and do some face-to-face work as well. So we went round to some of the district partnership groups. We did some work within the acute hospitals, in the quality improvement hubs, to gather people's thoughts and feelings around the healthcare passport and their experiences of using it.
We were talking to the manager of my daughter's care home just recently. She said, we've got them now for everybody, and obviously they've had some cases of some of the residents going to hospital recently, and she said it's quite clear that nobody looks at it or reads it. So that is another issue, really. And in a way, from the research, this was something that I was hoping to be able to explore more.
On a ward, we have quite a strict sort of routine in how we do things, and often that doesn't fit in with people with learning disabilities. A lot of them aren't able to be flexible in how they do things, and it's us being able to adapt for their needs. And maybe changing the way we do things to make it easier for them to be able to cope with things. Communication is a big thing. Those that can't communicate, if they haven't got carers to help them in communicating.
The NHS is required to refer all of its employees to the Disclosures and Barring Service. The employee must be able to present legal identification papers before the DBS check can take place.
I had a lot of problems regarding the DBS check because I didn't have the relevant identification, didn't have a passport, I didn't have a driving licence, I didn't have any form of ID that they needed me to have. Originally, they wanted me to have all my fingerprints to prove who I am and everything. I felt so victimised by them, and in the end, I felt like giving up, because to go to a police station and just to prove that who I am was ridiculous.
It's as much about the process as the outcome, and it's as much about the collaborative action as it is about the use of the passport. And one of the really important elements is looking at the barriers that that might exist. And this was a clear barrier to people with learning disabilities being able to do research. So it was a major theme throughout the research that we could not ignore.
In the end, we decided that we weren't going down that route, that they decided to get me a passport, and then that's how I was able to prove my identification.
We were saying that people with learning disabilities had the same status as everybody else, but didn't have. And that didn't feel very comfortable for anybody.
He was constantly encouraging me to stay because he said I was an inspiration to the group and that he needed me to be part of the group because otherwise it wouldn't have been the same without me.
If NHS England is saying that health services ought to be employing more people with learning disabilities, if people don't have that level of identification to be able to get into those jobs, then there's a natural barrier there that actually is going to need to be traversed.
One of the things that needed changing, for instance, was accessing it online. Although the paper it looked quite good, but there was limited space on there, and accessing online wasn't very easy. I went back to the school where I worked because the children were all residential there. I spoke to the matron there and she said, well, I find when I'm accessing it online, this is going wrong with it online. So we got those things changed as a result, which was great. So, it was a really good outcome, that.
And we got kind of opposing views because I'm hospital based. We had people from the community. So I was seeing that in the hospital, we get people that come in and they haven't got their passport with them, whereas the community people are thinking, well, why aren't they being given a passport when they're in? So there was kind of opposing views, which we had to kind of deal with and look at where do we actually give out these passports so that people have them before they come in. Somewhere like A&E is not really an ideal environment to be handing out a passport and getting a carer to fill in when it's a stressful, busy environment, and you need the information there and then.
When we started getting out there and consulting, we recognised that we needed to be communicating much more swiftly than just the meetings with each other. So we created the WhatsApp group. One of the team, I think Mandy, suggested we use a project management piece of web-based software, and so there were various forms of data that we were able to use to plot the group's journey through that project and to support that kind of reflection for everybody about their role as co-researchers on that journey.
The whole view of a passport and the fact that we looked at that and changed it made it look like it wasn't just a document, here it is, you can fill it in. We looked at what's in it, is it all useful? So it was changing as opposed to just look at the document, do people use it, yes or no, here it is kind of things.
There was a lot of feedback around how we could improve the healthcare passport. And then there was a recommendation that we needed to do more work to raise and sustain awareness of the healthcare passport. And then it was identified that actually we ought to be looking into how IT systems could support the use of the healthcare passport.
One of the problems that was brought up is one of the sections is medication, but for a lot of people the medication could change 2 or 3 times a year, and if they're writing out the whole booklet, that's time consuming for someone to fill in. So that's one of the things that we wanted, is that it was a bit more adaptable and flexible, that the person is able to add and change without having to write out a whole document again. So they just change that page. They can change it on the computer, print that page, and it's done.
It's as much about the implementation of it in the future as it is about recognising that not everybody had heard about it up until that point.
Show people what the passport is and raise the profile and awareness for people and be able to go out and say this is what we did as co-researchers and be able to promote it.
I have to say Tina is an inspiration of what she does and what she's involved in, and I just was so pleased to be able to meet her and work with her.
When I go to certain different outside of Kent, I say to people, this is what's happened within Kent, and then it goes on and people say, wow, that's a good idea, let's use it elsewhere.
When I've spoken to patients since that come in, they seem to be much more prepared and come in with their passport. And it seems, that seems to be improved.
My main concern about giving birth was because I have a hospital phobia, as it were. I don't like hospitals, so I think, oh my God, this is going to be the worst experience ever. But actually, it was the most supportive environment giving birth, because I was constantly being looked after on the labour ward, where doctors were constantly making sure that I didn't have any fits at all. So I was constantly being asked how I was feeling, where I needed the support, and if I needed them, I was to call. So I was very supported on the ward.
If somebody asked me, I probably would say yes, and I'd probably get involved in something like that again, because it's just important if you can make a difference, especially for them, because it's very hard. That going into hospital is very hard, and that lack of flexibility and everything is so difficult. So I think, if someone asked me, could you come and do something because you might be able to help us to make a difference, I would do it, yeah.